and welcome back to Eye on Cancer. We're here with Dr. Raja Mehdi, our own Pahrump medical oncologist, and we're answering your questions. And we're going to move right into the next one. This one, it just struck fear in my heart when I saw the question. I have a lump close to the skin on my breast near the nipple. Is it something I should worry about? Could it be cancer?
You absolutely need to have this looked by a provider.
Yes.
So there's no question about it. If this has gotten your attention, I'm glad that you're doing self-breast exam to catch it, but you should absolutely not ignore it. Not all lumps are cancer, depending on the age. So it doesn't mean automatically that it is cancer. Having said that, it absolutely needs to be evaluated by your healthcare provider.
And just on a personal note, that's how I discovered mine. It was on Christmas morning. I was in the shower preparing to go for Christmas Day, and there it was. It was like, I'll give a description. It was like the eraser on a number 2 pencil. And it just appeared out of nowhere. And I made an appointment and went to a cancer specialist, and she did a biopsy, and the results came back, and it was cancer. But earlier on in my life, maybe like 4 years earlier, I discovered a lump, and it was not cancer.
I think I'm glad that you mentioned that.
Yes, and so just because you have a lump, it doesn't, like Dr. M said, it doesn't necessarily mean that it is cancer, but you should take the time and get the advice, because the stress, there's always stress that I know that the second time I was very relaxed. I didn't, I wasn't worried about it, because the first time it wasn't cancer, but I jumped right on it. And I'm glad that I did, because the second time it was cancer. And
excellent.
So
couldn't have given a better answer than that.
Okay, first-hand experience. Now, we're actually revisiting a topic. Our last question is, if you could recommend a good regimen of vitamins and dietary supplements, which would you recommend to prevent cancer in general?
There has been a lot of research on it, but no conclusive evidence that any particular vitamin will definitely prevent cancer. What I would say is you need to have a healthy, balanced diet. No amount of supplementation, a pill in a bottle, no matter how good somebody says it is, it replaces balanced nutrition. So having said that, a lot of us don't get out in the sun that much. So my vitamin D level was low a while ago, I found out, and I had to take that supplementation. So I think calcium and vitamin D overall is a good idea for bone health. If you want to take a regular multivitamin, I would not suggest spending a lot of money. Just a regular store brand once a day should be fine. If you are undergoing cancer treatment, it is always best to ask your doctor, because some of the vitamins and supplements can interact and either decrease the efficacy of the chemotherapy or can cause more side effects. So that you have to be careful not to over-supplement. A general good guide to nutrition, which includes these vitamins, you can find on cancer.org, cancer.org. There's a nice nutrition section. It's also available on Hope Cancer Care's website, that's hccnevada.com. And on the patient information section, it'll take you right to the cancer.org page.
A lot of good information. Okay.
Yeah, I think it's pretty comprehensive.
And I think that we should revisit your research on the the availability of doctors' services locally, that the insurance company sometimes will say, well, no, you have to go to Las Vegas, you have to travel. And you did some research. So if you could just reiterate that so that people can be taken care of.
Sure. And it's generally an issue of not having enough information. Because, the person that's answering the phone on the other side at the insurance company, they're just showing up to work in the morning and doing their job.
Right.
It's not like they're bad people trying to do
That's
bad
right.
things. They just don't know. They have the guidelines. But if you have a Medicare Advantage program or Medicare replacement, I should say.
Okay.
These are generally HMO plans which cost a little bit less so that you don't have to pay the 20% or so that Medicare doesn't cover. And, and having said that, if you sign up, then the access is restricted.
Okay.
So you will have to go see particular providers, and some of them are far away. And that's not only for cancer care, that applies to any provider. So if you have your doctor here in Param and you do not want to travel to Las Vegas, but your Medicare HMO plan obligates you, you can access this resource. There's a nice article which lays out the guidelines for all of these Medicare Advantage programs. I will read it out here, but before that, it'll also be available on the KPVM's Facebook page. There'll be a link there. And I'll work on having a link on the Hope Cancer Care's website as well.
Good.
It specifically reads that coordinated care plans such as HMOs and PPOs and PAC plans are generally required to reimburse non-contracting providers at least the original Medicare rate for Medicare-covered services.
So that's good information. You can find that on the television Facebook page and soon on Dr. Mehdi's website. So once again, you can get your questions answered right here by calling 727-9400 or emailing to eoc@kpvm.tv. Doctor, we're out of time. This information is so valuable. I thank you so much.
You're very welcome, Linda. Glad to be here.
Come back next time. We'll answer more questions.